Hello everyone, welcome back to USTM Podcast, where we bring you expert discussion on topic that matters. I'm your host Fetisha Syemiong, a student of law at University School of Law and Research, USTM Meghalaya. And today we'll be diving into a crucial chronic skin condition which is eczema and psoriasis. In today's episode, we have an expert and a special guest, Dr. Aslam Ali, Assistant Professor and Consultant, Department of Dermatology at Sangma International Medical College and Hospital, Meghalaya. We are pleased to have you here, sir, with us today. Thank you.
Thank you, Fetisha. I'm pleased to be here. Today we are going to discuss two very important skin conditions, which are eczema and psoriasis. These are very important in the sense because they affect around 200 million people worldwide. And these are chronic conditions, so we have to live with them. So today we will be discussing why we have them, and we will be debunking some common myths that are present. We will be discussing what are the treatment options available for these conditions, and we will be discussing some lifestyle changes that we can do in our day-to-day lives to keep these conditions under control. Happy to be here.
Sir, as you have mentioned that the skin condition affects many people, millions of people. So what exactly is eczema and psoriasis?
Okay. So these are two chronic skin conditions. So let's first discuss eczema. So eczema is an allergic condition that usually affects children. Around 20 to 30% of children will be having and around 2 to 10% of adult people will develop this condition. Eczema, most commonly known as atopic dermatitis, is a skin condition where there is itching in the skin which gradually rashes. It is itch followed by rash. It usually happens to be more common in children around 6 months of age to up to their adulthood. Mostly the rash appears on the flexural areas. Flexural areas means like your flexure of your elbows, flexure of your knees. Sometimes in atypical variants, it can be there on extensors as well. Face is quite frequently involved. Other areas like scalp and other areas can also be involved. And the other condition, which is psoriasis. Psoriasis, on the other hand, is also a chronic skin condition which is characterized by erythematous, which is red, scaly patches, mostly covering the extensor areas of the skin. It usually presents in a teenage group or in a middle age group like 30 to 40 years of age. Red scaly patches appear on the extensor areas of your arms, extensor areas of your legs, sometimes on the scalp, sometimes on back. And these usually first the rash appears and then followed by itching, compared to eczema where itching was present predominantly followed by the rash. Sometimes it is very difficult to differentiate eczema and psoriasis, especially in the children, because there might be an overlap of the two conditions. Otherwise, because of the age group differences and the typical morphology of the lesions in these two conditions, it's very easy to differentiate the two conditions. So basically, to summarize, eczema is an allergic disorder. However, psoriasis is an autoimmune disorder affecting the skin. Here, red scaly patches appear on the extensor areas of your arms, extensor areas of your legs, sometimes on the scalp, sometimes on back. And these usually first the rash appears and then followed by itching, compared to eczema where itching was present predominantly followed by the rash. Sometimes it is very difficult to differentiate eczema and psoriasis, especially in the children, because there might be an overlap of the two conditions. Otherwise, because of the age group differences and the typical morphology of the lesions in these two conditions, it's very easy to differentiate the two conditions.
So, sir, as you have given us what is exactly eczema and psoriasis, and also you have given us the understanding of it. So, what causes it?
Okay, so let's discuss one by one. Firstly, we'll discuss eczema. So, to discuss what causes eczema, we will compare our skin with a wall, brick wall. So brick wall has two components, just like our skin has two components. Firstly, it's the bricks, okay? And what is keeping the bricks in place is the mortar or the cement in between. Similarly, our skin has one bricks, which are the skin cells, also called as keratinocytes. And then there is intercellular proteins, which are the cement which hold those skin cells intact. So what happens in eczema, this cement that is kind of holding the skin cells tightly packed together is lacking, mostly filaggrin protein. So since this intercellular cement is lacking, what happens is your skin has too many pores, small holes. So what will happen if a brick wall is there with no cement in it? There will be a lot of gaps. So through those gaps, what happens? Your intracellular water, whatever water you have inside your proteins or whatever, kinds of dries out. This is called transepidermal water loss, TEWL. So because of this water loss, your skin tends to become dry. Because of the dryness, you'll get itch. Also, this porosity of the skin will allow environmental pollutants like dust mites, pet dander, other environmental pollutants to seep through the skin and activate your immune system. Once your immune system gets activated, it will start reacting. It's kind of an immune dysregulation. Once it starts reacting, it will produce inflammation in your skin, which will lead to further itching. Also, this inflammation will not stop at your skin. It will continue on causing these allergies. Gradually, the people with atopic skin or atopic dermatitis will develop other food allergies because of this immune dysregulation. They will gradually develop something called the atopic march, which is after the skin atopic dermatitis, they will develop food allergies, then they will develop asthma, lung allergy, and allergic rhinitis, which is like constant sneezing to mild dust exposure. So this is the basic mechanism. Plus, basically, it's a defect in your skin along with immune dysregulation. However, in psoriasis, it is mostly an autoimmune condition. So I'll try and explain autoimmunity slightly. So the purpose of our immunity is to target external pathogens. Like one bacteria is coming from outside, one virus is coming from outside. We have to kill it. For that, we have our immunity. But what happens in autoimmunity, the agent, the external agent, is not coming from outside. It is something within your own body. So your body will start targeting that agent and start killing it. What happens in psoriasis, because of some DNA damage, maybe because of ultraviolet rays, maybe because of some bacterial infection, maybe because of some trauma, some neoantigen inside your keratinocyte, the skin cell, gets unmasked. Once it's unmasked, your immunity will start targeting it, will start killing it. Once it starts killing it, to replace it, more and more skin will be produced. So what happens in psoriasis? Because of this autoimmunity, it starts targeting your skin. Ultimately, skin to repair will produce more skin cells. Our skin cells do change. Like we have a skin turnover time of 1 month. They change very slowly over a period of 1 month, where we cannot discern like we are shedding the skin. But what happens in psoriasis? That skin turnover time gets reduced to 10 times. Like you can change your skin in 1 day. So this very abrupt change in your skin turnover will lead to visible exfoliation of your skin. And because of this autoimmunity, there will be proliferation of blood vessels in your skin, which will lead to the red color of the patches. So this may be because of a lot of conditions, maybe because of some drugs, maybe because of some infections, maybe because of some trauma, are basically the common conditions that precipitate psoriasis. So I hope the basic pathogenesis why eczema happens and why psoriasis happens is clear to our viewers.
So it's really concerning how a skin disease can affect other external health like asthma and all. So what are the risk factors when someone develop this psoriasis or eczema?
Okay, so we'll discuss one by one. The most common risk factors in eczema are usually genetic. So there is genetic means like you get it from your parents. So this the cement protein, filaggrin protein mutations are present in almost 60 to 70% of patients with atopic dermatitis. Other than genetic factors, the other important triggers are environmental, mostly dust allergens, pet dander, whatever the pets are shedding, hairs and all, some environmental pollutants. Some foods can also trigger eczema, mostly proteinaceous foods like eggs, nuts, soya bean, fish, meat, those stuff. And sometimes stress can also aggravate the condition, because this cortisol is a stress hormone. Once we are stressed, this stress hormone goes up high, and once the stress goes up high, the itching can be more pronounced. And coming to the triggering factors of psoriasis, uh, in some cases it can also be genetic, associated with an HLA-CW6 gene, in which genetic, because we get it from our parents, they will present very early in life, like around 13, 14, 15 years, like that. Other triggering factors for psoriasis will be trauma, because wherever you will get injury or cuts or any kind of pressure, those sites can develop psoriatic plaques. Other than trauma, there can be some infections that can cause psoriasis exacerbations, mostly streptococcal, one bacteria called streptococcus. It causes some tonsil or pharyngitis like infections. They can aggravate the condition. Other than infections, there are some drugs that can precipitate the disease, mostly beta blockers. Beta blockers are used to treat heart conditions like blood pressure or something like that. And lithium is a drug used by psychiatric people that can also precipitate psoriatic plaques. Other than that, there are some antimalarials can also precipitate the condition. Other than that, there are some baseline inflammatory conditions like being overweight or obese can cause like baseline inflammation, which can also aggravate the disease. Other than that, some other lifestyle habits like smoking, alcohol consumption, they can also lead to inflammation, leading to aggravation of the condition. So these are basically some triggering factors for these conditions.
So we have learned many risk factors. You have given us like which we are unaware that it happened to us, but we don't know. So, sir, I heard that there are different type of eczema and psoriasis. So, what are the types?
Okay. So let's discuss different types of eczema and psoriasis. So eczema, the most common form is atopic dermatitis, which we already discussed, like that happens in children. Other than that, there can be some adult forms also. Mostly allergic contact dermatitis, which happens when an allergen kind of irritates your skin and causes immune dysregulation. Other than that, there is irritant contact dermatitis. That is because of some irritant substance like metals or hair dyes irritating your skin. Other than these two eczematous forms, there is something called dyshydrotic eczema, which happens in elderly on their palms and soles. Other than that, there is other form called lichen simplex chronicus, which happens in your extremities because of constant scratching. The skin kinds of hardens and becomes very dark, pigmented. So these are the different forms of eczema. Now coming to psoriasis. So psoriasis can be classified depending on the site it involves and the type of lesions it presents. Depending on the type of lesions, firstly, the most common one is chronic plaque psoriasis. Here, those classical erythematous scaly plaques happen to occur on your extensors like we discussed. Other than that, there is something called gutted psoriasis. It happens in children after post-streptococcal throat infection. Here, very small fine lesions happen on the entire body, back, trunk, like that. They are very small in size, but they are scaly and erythematous. Other than gutted psoriasis, there are some severe forms of psoriasis like erythrodermic psoriasis, where the entire 90% of your skin will turn red along with scaling. You will not be able to differentiate the plaques. All will coalesce into a big red person. It's a medical emergency. The patient will need hospitalization. Other than that, we'll have pustular psoriasis. What happens? Pustules are like small white pus-like lesions that will happen on the already present erythematous plaques or de novo skin areas. It can be also like localized pustular psoriasis or generalized pustular psoriasis. Other than pustular psoriasis, there can be other forms like depending on the sites, like scalp psoriasis. If the lesions only involve your scalp, there will be something called nail psoriasis, where there will be small pits developing on your nails. There's something called psoriatic arthritis, where the inflammation may or may not be there on the skin, but the joints are inflamed. So it's not a condition limited to skin. It can also involve your internal systems. Psoriasis will involve like every system in your body. It can involve your joints, it can involve your liver, it can involve your kidneys, it can sometimes also involve your eyes, like that. So these are basically some common types of eczema and psoriasis.
Sir, as you have mentioned that this skin condition can affect our internal organs like liver, our eyes, nails. So what are the available management we can take in order to prevent this?
Okay, thank you for the question. So we'll be discussing one by one. Firstly, coming to the management of eczema. So it depends on how severe the condition is. For example, if the condition is limited to one part of the body or few parts of the body and not generalized, we can go for topical creams, lotions. Firstly, we know that there is barrier dysfunction because the barrier is not there. So we have to maintain the barrier. How will we maintain the barrier? We will start with moisturizers, creams that contains that barrier. Twice, basically ceramide containing moisturization. Moisturizing the skin is very important part of treatment in eczema. Secondly, to reduce the inflammation, we can use anti-inflammatory creams, which is mostly topical corticosteroids. Depending on the severity, we can start with mild steroids to we can go to moderate to potent steroids. Other than steroids, we can go for topical calcineurin inhibitors, which are mainly tacrolimus, pimecrolimus. These are steroid sparing agents. They will kind of reduce the use of steroids. If the lesions are more severe, we can go for something called a wet wrap therapy. Wet wrap therapy, what we do, we will apply a blend of these topical corticosteroids and moisturizers on the affected area, and we will wrap it up with a wet gauze and keep it there for half an hour to 1 hour so that the medicine seeps into the lesions and kind of it potentiates the effect of the medication. Even after applying these two, if the condition is not getting controlled, then we have to also add on oral therapies. Oral therapies will include, like, first line will be oral steroids, but oral steroids cannot be continued for very long. So we have to go for steroid sparing agents. Steroid sparing agents will include other immunosuppressants like cyclosporine, methotrexate, and what the cutting edge technology, newer advances in medical conditions provides us with new class of drugs, which are biologics. So there are a lot of biologics which target a specific antigen on your skin and kind of control the disease. So there are a lot of biologics available for the treatment of atopic dermatitis. Some recent advances have helped us with drugs like dupilumab to control the disease, but these are very costly and reserved for very severe disease. In mild to moderate disease, we can control with topical and oral steroids or topical other oral immunosuppressants. And after this eczema management, we'll discuss something about psoriasis. So psoriasis also, the management goes in similar lines. If the disease is very limited to one part of the body, few plaques, involves less than 10% of the body surface area, then we will go for topical agents, which will be mostly topical potent corticosteroids to be applied on the patches along with moisturizers. Other than that, we can go for vitamin D analogs, mostly like calcipotriene or calcipotriol creams. We can also go for coal tar application. It is a substance that reduces inflammation, apply on the patches. Other than these, we can go for other topical agents along with something called UVB therapy, which is called PUVA therapy. So here we apply the medication and expose it to ultraviolet light. That also kind of takes care of the inflammation part. However, if the disease is involving more than 10% of the body surface area, or lesions are there on face or hands where patient feels very, going out very conscious about themselves, like if somebody is cooking and they have lesions on their hand, people will not eat. No, they will kind of try to prejudice the person, even though the disease is not communicable, but prejudices are always there. So for those patients who need like quick treatment, quick cure, we can go for systemic agents. Systemic agents are mainly immunosuppressants or antimetabolites like methotrexate. They will reduce the inflammation as well as the cell turnover. Other than methotrexate, we can go for cyclosporine. So other than methotrexate and cyclosporine, we can go for newer class of drugs which are biologics. Biologics are mainly targeted therapies against a specific cell line. So in psoriasis, what happens? Mainly T helper 17 and T helper 23 cells are active. So we have biologics targeting these cells in the form of secukinumab, ustekinumab, and other similar drugs. But these again are very costly and are reserved for specific population. Mostly with this topical medicines and oral methotrexate and cyclosporine or apremilast or acitretin, we can get a lot of conditions under control. However, the thing to note about this, these eczema and psoriasis can only be brought under control. They cannot be cured for life. So whatever management we are doing, we have to kind of taper it down to a bare minimum level and continue with that for prolonged periods so that patients do not develop flare-ups. Other than that, we'll also have to explain some lifestyle modifications for them so that they can help them to keep the disease under check.
Sir, since the skin disease can be controlled by ointment, steroids, medication, but as you've mentioned that steroids cannot be used for a long time and medication are too expensive, and also the skin disease cannot be cured but can be controlled to a certain level. So, sir, can you give us certain lifestyle which one can adopt in order to control them?
Okay, since we already discussed that we cannot cure the condition, but we can only get it under control. So doing some lifestyle modifications at our own level will definitely help increase the efficacy of the treatment and maintain that remission from the condition. So firstly, in eczema, we have to incorporating a moisturizer in your day-to-day life is very important. Use a good ceramide based moisturizer and use it very frequently, twice, thrice. You should be applying moisturizer exactly within 3 to 5 minutes after taking a shower on your wet skin to lock in that extra moisture. Plus, other than doing moisturization, you can avoid very dry, very cold climates. You should avoid very hot baths because they will strip off your skin for extra moisture. Other than that, you can improve your diet. Diet will include like food rich in omega-3 fatty acids. There will be mainly like fish liver oils, some fish like whatever fish is available, good fish, quality fish oils, fish liver oils. Some seeds like chia seeds can be taken for increasing your omega-3 fatty acid content. Other than that, you have to reduce your stress because stress will increase your cortisol levels, which will increase your itching. So to reduce stress, you can go for meditation, or you can also go for journaling. Like you journal whatever you eat, and if some food caused aggravation of your symptom, you can definitely get an idea from your journal. Maintaining proper sleep is very important because it kind of reduces. So these are some cortisol levels and lifestyle modifications that you should do in eczema. Other than that, you should also kind of avoid very much dust exposure, or if you have like pets, you have to take care of this dander control. Pet dander needs to be controlled because it will definitely trigger your allergies. Coming to psoriasis, in psoriasis, diet is not very significant. However, you should reduce consumption of very fatty meals because they will increase your inflammation. Exercising and reducing your body weight to a proper limit definitely will reduce inflammation and help in your condition. If you are smoking or consuming alcohol, you can definitely bid them goodbye. And stress management is also very important in psoriasis. For that, you can go for meditation. And maintaining a healthy sleep pattern is very important for managing psoriasis.
As we have discussed all the factors, the causes, the treatment, the prevention, so let's talk about myths. So the first myth is it communicable like eczema and psoriasis?
Okay, so this is a complete myth. Eczema as well as psoriasis are not at all communicable. Even if you stay with the person, you eat with the person, you sleep with the person, you are not going to communicate that disease from the person to yourself. This myth stays debunked.
So did it happen because a mother ate something during pregnancy?
This is also a myth. I'll debunk it. It did not happen because your mother ate anything during the pregnancy. It is something which you developed afterwards. So this myth also stays debunked.
So will homeopathic and Ayurvedic, can it cure this disease?
Okay, so some Ayurvedic preparations can definitely help control the disease, but since the disease, as we already discussed, is not curable at all by any medications, any form of medications in the present scenario has not proven to be a complete cure for the disease, be it homeopathic, allopathic or Ayurvedic. So this myth is also partially debunked. No medications can completely cure it. But however, with proper medications, we can definitely bring them under good control.
Sir, can this happen because someone ate too much meat or too much fats in their diet?
Okay, so this is also not completely true, because some food items, like as we already discussed, like nuts, protein containing foods like fish, meat, can aggravate your eczema, but they do not cause them de novo. They will not start the disease. So this myth is kind of partially correct, not completely correct. Again, no food item has been shown to be a causative agent for psoriasis. So in cases of psoriasis, this myth stands completely debunked.
Thank you very much, sir. We are pleased to have you with us today. And as you have shed light on various skin disease like eczema and psoriasis, how it causes, how do we prevent it, what are the various factors that triggers it, and what are the diet one should take. So thank you very much, sir. And I hope this session has helped many viewers to understand the causes and how do they prevent it. That's all, sir. Thank you very much.
Welcome. Thank you so much for having me here to discuss this important skin condition, Fetisha. I hope our viewers will gain a lot of knowledge from this discussion, and it will help them kind of get power over their condition, and it will not these conditions will not stop them from enjoying their life. More power to you, our viewers, and please do share this video with whoever you think is suffering from the conditions and need some valuable insights into the condition, into managing these conditions. Thank you so much. And thank you so much, Fetisha, for having me here. It was a very nice discussion. Your questions were very to the point, and I hope it helps our viewers a lot. Thank you so much once again. Nice being here.
Thank you very much, sir. We're pleased to have you with us today. And to all our viewers, we hope this discussion has helped you understand the various chronic skin conditions and has also helped you understand how to prevent it from happening. Also, if you have found this podcast informative, do not forget to like, subscribe, and share to our channel. Until next time, take care, stay safe, and stay healthy. Thank you so much, and stay tuned for the next update.